Around 8.4 million people in America are suffering from chronic wounds. I see a lot of specialists doing wet to dry dressing, which is a common misnomer or which should not be done in most wound cases.
Okay.
That makes the wound worse than anything else. So I always say that diabetics should take care of their feet more than their faces. So that's how, when the wound does not heal in 4 weeks, it becomes a chronic wound. Hyperbaric oxygen therapy, which we are going to bring in SAAK Healthcare. It's going to be available from November.
Oh, and the next thing you mentioned was the AI. So tell me how AI is being used.
So right now, AI is in our...
Well, hi, Dr. Asija. Welcome to the show. Thanks so much for taking the time to meet with us, and so we can all learn a little bit more about wound care and SAAK Health.
Thank you for having me.
Excellent. Well, let's just get right into it. Tell us a little bit about SAAK Health and wound care in particular, and why SAAK Health is so interested in helping folks with wound care.
SAAK Health is a multi-specialty clinic that we founded in 2023. It's been almost a year that we have started this clinic. It has a multi-specialty group. We have cardiovascular services, urogynecology, and wound.
Okay. And was there something in particular the leaders at SAAK, when they were putting everything together, all the different things that they're doing to help people? Why wound care in particular? What's so important about wound care?
So wound care is one of the most underlooked branch of medicine. As you know, wound care comes with a lot of stigma.
Mm-hmm.
And I felt there was a sense of abandonment for these patients. And this propelled us to go into wound care. And wound care ties up very good with the vascular services that we offer. So with a hyperbaric chamber in place, vascular services, and localized wound care, I thought this would be a good option for us and a good foray into wound care.
Great. So you mentioned how wound care is stigmatized. Why do you think that is?
So wounds are not pretty.
Yeah.
So around 8.4 million people in America are suffering from chronic wounds. And it's going to be a $5.4 billion industry by 2034. With that said, the stigmas attached to wound care is these people are ostracized because of the way the wound looks, smell, and they are left behind. So that's the reason I feel that there's a lot of stigma around wound care.
That's great. When things are stigmatized like that and people are kind of marginalized because something they're experiencing with their health, often you feel kind of alone, and when people don't understand, and then you might be embarrassed. So, I think it's great that you guys are focusing on that. Help us understand a little bit more about wound care and how 8.4 million or whatever that number was. Why is that number growing so much? Why are there so many folks that are suffering?
Wounds happen due to multifactorial reasons. So this could be diabetes, and diabetes is the foremost disease that we are battling as a healthcare provider, and also old age, and trauma, and also poor nutrition. Poor nutrition means obesity. Not the other way, not undernutrition, but poor nutrition means people and weakened immune system.
Okay. So when someone's struggling, like let's say with the poor nutrition, obesity, is it because they're in one spot too long, or maybe they get injured and then that wound doesn't get treated well enough, or
lack of blood supply to that organ? To the point is, especially the legs, you see a lot of venous ulcers and arterial ulcers in that area. And you must have heard about lymphedema, lack of lymphatic drainage. So these people are prone to ulcers.
Wow. So in particular in our area in the Midwest, is it more common? Is it a regional thing where you see, like, let's say, wound care numbers higher or lower, or is it just kind of?
I think it's global.
All over.
It's
really
global. The poor choices of diet that we do as a country in general, and lack of exercise, lack of movement, and this would give rise to things like pressure ulcers, venous ulcers, and arterial.
So, if someone's going to come in for care, what are some of the ways that you're first working with them? Obviously treat the wound, right? There's that part of it. But besides that, are there other things that you're helping with?
So the wound care person comes. So you really want to know what kind of wound it is. Is it a pressure ulcer, diabetic foot ulcer, post-trauma, post-burn, or is it a venous ulcer? You go into diagnostics, which we have in our clinic, which would be ultrasounds, an arterial ultrasound or venous ultrasound.
So you don't have to send them somewhere else to
No.
get all that done.
No.
They can come here and have
Yeah,
that, right?
so it's a one-stop shop for us to take care of these wounds. So after the diagnosis, you try to do conservative management. That means doing incision and debridement, clear the slough or the biofilm as we call it.
Okay.
They treat them with antibiotics if necessary after doing a culture.
Mm-hmm.
And then we try to do specialized dressings. These dressings might have antimicrobial treatment like silver or iodine or anything like that to help them heal.
Mm-hmm.
If the wound does not get treated in 4 weeks with conservative treatments, then we have advanced therapies available like cellular tissue products that helps to accelerate the wound healing without infection.
Okay. You find that people who are suffering from these type of wounds, because of some of the stigma and because of some of maybe the embarrassment or they don't know seriousness of it, you find that they wait often too long to come get help, or maybe they don't know that the help is even available for them?
Yes, that is correct. That is correct. And unfortunately, our medical fraternity is also overlooking this because we are still I see a lot of specialists doing wet to dry dressing, which is a common misnomer or which should not be done in most wound cases.
Okay.
That makes the wound worse than anything else. And if we do not treat the chronic wounds, it will lead to sepsis, infection, and unfortunately, amputation in diabetic cases.
Wow. So let's say if I was a patient and I finally got over, let's say, maybe a fear to come in, what would I expect as far as, is the treatment painful? Is, those kind of things. So I know as a person, sometimes I don't like to go, let's say, to the dentist or the doctor in particular, because it might result in something that I don't want to do.
You are young, so you will experience pain.
Mm-hmm.
But most of the people who are diabetic won't experience pain because of sensory impairment of the nerves.
Okay.
And main goal is to have less pain. So we give them treatment like a localized, like an anti-anesthetic gel before doing any procedure to help them with the pain.
Well, that's good. That's good, because I think a lot of folks we've got that reflex to avoid pain, and sometimes that's what keeps us from coming in the first place. Mm-hmm. From a standpoint of how long does it take, on average, if you could even say, I'm not even sure, for a serious wound that you're going to be treating to kind of start to get better? And
it depends on the depth of the wound, the cause of the wound, the duration of the wound. So it varies by patient to patient, but at least 6 to 12 weeks would be a minimal for any wound to heal. They have to see a provider and do dressing changes regularly. They have to see the provider weekly, and then they will have dressing changes every alternate day.
How does someone know when it's time to come in if they've got something that's developing? Are there signs? Are there, because you said most people wait longer than they should.
Mm-hmm. So I always say that diabetics should take care of their feet more than their faces. So that's how it should be. So if there is any small abrasion, cuts, or anything that is causing pain, that's taking a little bit of time to heal, or if you see that the wound is increasing in size, depth, or there is a drainage, so these are the signs that you should be looking. And a small cut can become an ulcer very quickly.
Yeah, we go through our whole lives getting nicked and cut and bumping into things and stubbing our toes. And I can understand and empathize with someone who thinks, oh, I just stubbed my toe, or I just stepped on a nail, or I just kind of sliced something when I was working. It'll heal in a couple days, but then it doesn't. We're not connecting, or maybe a condition that we have with something that could get worse from it.
And when the wound does not heal in 4 weeks, it becomes a chronic wound. So that's what the criteria is. This is acute wound or a chronic wound. Usually people who are healthy will heal well, but these people who have all these comorbidities will have problems healing.
Okay. If something doesn't heal in 4 weeks, it becomes a chronic wound. Does that mean it's not able to heal itself without intervention?
It will need more help than your
body can get.
Yeah.
Right. Any other misconceptions about these types of wounds and folks that suffer from chronic wounds, or even diabetes, or any of the other conditions that can make these things more? Are there any other misconceptions about that, or wound care in general, you'd like to kind of
People say that exposure to air will help to heal a wound faster, which is not the case.
I always thought that too. Even for my kids, I'm like, don't keep a Band-Aid on it
Yes,
for too
yes,
long because
yes.
it needs air. So that's not true.
And overuse of antibiotics. Wound don't heal just with a systemic antibiotic. It has to have a localized treatment. Sometimes you need more than antibiotics.
So that's a really good one, even though I'm not dealing with that type of wound myself or with my kids, but I used to always say that. Why is it that people think that, air cures it?
I'm not sure. I'm not sure. But the point is, yes, it's a misconception for sure.
Wow. Okay.
So what happens when you are exposing the air to the wound, you're drying the wound essentially.
Okay.
But wound needs blood, moisture, and oxygen to heal.
Okay. So like a mix.
Mm-hmm.
Interesting. Tell us a little bit how you yourself got into wound care, as for like how you got started, as far from education. Like when you got started in your profession, was it wound care you were looking to get into? What?
So my background is family medicine.
Okay.
I was an urgent care physician for 16 years
Oh wow.
for Premier Health Corporate.
Okay.
So I had a midlife crisis.
Oh boy.
So
Instead of buying a little red car, you said, I want to change careers.
I wanted to see what's out there within the scope of my practice. And I felt that I should help people more.
Okay.
And that gave me an insight into wound care and the sense of, again, I'm bringing this on, the abandonment by society and the stigma associated with wound care propels me to do. I love it now. I mean, I never thought I'll enjoy wound care so much.
Well, when you're making a difference in someone's wound and their ability to be comfortable and changing their life to some degree.
And the point is, if you see a flower mature and seeing the skin grow, it carries the same meaning for me.
Okay, that is cool. That's really
cool. So to regenerate an organ, and that to a stubborn one, it's challenging.
Yeah.
It's beautiful too.
Absolutely. I agree. I've never thought of it like that, but I do agree with that. Was there something in general during that time when you were looking to make a change? Had you been exposed to helping people with wounds before, maybe a little bit, or was there something in particular that inspired you?
When I was an urgent care physician, I was not able to do this. I was not able to help these patients who came to us with chronic wounds, and I felt that why am I not able to help them? And that inspired me.
Wow. Things in our careers or lives that cause us to take a left turn and go a different direction. Those can be really important. Anything you'd like to share in particular about people that you worked with, really kind of miraculous things that have happened to wounds that everybody thought wouldn't heal, or things that you've run into?
So we had an elderly gentleman who was going to hospital because of his chronic wounds.
So he was just giving up.
They had given up, family was giving up. That made us, that I took that as a challenge and helped him.
So you worked through that and was able to get him to a place where his wounds were healed and...
Wounds were healing.
Healing.
Yeah, they are still healing, right?
Yeah. Oh, wow. That's great. That is fantastic. So what do you think's next for wound care?
I mean, wound care is an ever-evolving play. I mean, we are doing thermal imaging, artificial intelligence,
Okay.
and also this is biomedically engineered cellular tissue products, which are very exciting. You should see the scope and what they do to the wound bed.
Really?
Yes.
So tell me first about the thermal.
So basically, it's like a sensor that will detect infection in the tissue. So it would be at least a couple of degrees more higher than the normal body temperature. So that's what thermal imaging is.
Infected tissue is warmer, so those thermal imagings can find that. So that way you can treat that tissue quicker.
Yep.
Where you normally
earlier.
Or earlier.
Earlier.
Okay. And I'm just trying to understand a little bit. To the naked eye, is it not as easy sometimes to tell what's infected yet, because it might not look infected?
It might not look at it. You have to wait at least 3 days to get a culture, but maybe with thermal imaging, this is all in pipeline right now.
Okay.
But
They're testing it.
Yeah.
That seems pretty exciting too, because if you can find faster.
Treat faster.
And the next thing you mentioned was the AI. So tell me how AI is being used right now.
So right now, AI is in our imaging techniques. So when we do imaging, we can take an AI-enabled device which will measure the depth of the wound. So that will help us to see how deep the wound is.
So let's say the AI device, is the AI software, is it analyzing that depth and kind of quickly
Telling you,
giving you feedback as to what?
it's spitting out the data right away.
Okay.
So that way, I mean, and we are still scratching the surface right now. There's so many exciting things that's coming in the wound.
So without that type of technology, what do you do to find the depth now?
We take our measuring tape and measure the wounds.
Really?
Yes. And that is simple enough. And I think that's the correct way also.
Yeah. So, but it's really just like a carpenter with his measuring tape. You
Yep.
Just measure it.
Yep.
What's a serious depth wound that you would be really concerned about?
The depth would be till the bone.
Okay.
The depth till the bone, that will give you insight whether this is osteomyelitis, which is infection of the bone.
Oh, wow.
So this is very common in diabetic foot. So if that is the case, then you have to go into MRI and stuff like that to see if there is what is the extent of damage in the bone or infection.
Mm-hmm. How would you treat someone that has an?
They will need IV antibiotics for at least 6 to 8 weeks. Then we have to do an infectious disease consult and take guidance from them. And then we also will do amputation in some cases.
Wow.
If the bone cannot be salvaged.
That's serious. Oh, and then you were talking about the artificial cellular.
The bioengineered cellular tissue products. These are basically, they can be coming from a human donor. So basically a placenta,
Okay.
chorion, amnion, chorion, amnion. These are the combinations that they use. And these go through rigorous washing to make a product then which FDA approves for application in the wound beds.
Okay.
They can be bovine, and some of them have started using pork and fishes too.
Really? And so how is that applied? How is that used? Is it applied to the wound and then it takes and it helps the wound healing?
Basically the wound bed takes it, and it will act as because it has a lot of growth factors.
Okay.
So it secretes growth factors for this to regenerate the skin.
Wow.
So it accelerates the process of healing.
And you said this is still in the pipeline.
No,
This is
we are
available
using
now.
cellular tissue products. Yes, there are a lot of companies, and these are the indications for.
How long has that technology been around?
Maybe at least 5 to 7 years.
Okay, so it's been getting better and better.
Better and better outcomes, better sizes, because some wounds can be 10 by 10 centimeters. Some wounds can be 2 by 2 centimeters or less than that. The application site sizes and the efficacy of these products is pretty remarkable.
That's really cool. Anything else in wound care that you see is kind of a future thing coming down the pipe that you're excited about or has you concerned?
I want to focus also on preventions of these wounds. Why should we not do something like lifestyle changes more? So for my wound care patients, I really talk about protein. Because protein is a building block for any organ or the skin. As skin is, the building block is protein.
Okay.
So a lot of protein, calorie, nutrition that will help us.
I love the sound of that. Protein free. I've come a long way in the last few years of really minimizing sugars and carbohydrates and maximizing proteins and fats, and it's just helped me a lot.
That's
maybe
great.
Maybe it doesn't help everybody. It's helped me a ton.
And as we grow old, I think we do not take care of the nutrition, which is the most and foremost things to do as we age, because protein is the key to regenerate that skin. Maybe in a small way, maybe antibiotics, wound debridement, cellular tissue products. But the main thing is protein also that we have to talk to. So I make a point to talk about protein with every patient. We should check a pre-albumin level also to check how much protein as actually the patient has.
Yeah. My knowledge is very lay. Is it a struggle with the folks that you work with? A lot of folks that are seniored in age or diabetic, they've been directed to a certain diet or lifestyle when it comes to the food they consume that isn't always easy to get proteins, because a lot of times your proteins, or at least your natural proteins, comes with a side of fat. And if they're, what are you finding with folks that their diet is and they're not willing to let go of in order to become healthier?
Most of these patients are in skilled nursing facilities, so it is difficult for them to get to order these food sources.
To really get what's on the menu, kind of.
Food sources for them. So maybe a protein drink just having a couple of eggs a day
Yeah.
in the morning and then trying to make like a protein for every meal.
Okay.
That would also help them. So these are the challenges these people face. And sometimes people don't like to eat at that age, because if you have an infection, you really don't want, you want to eat something that will satisfy your palate. So they are going after sugary drinks or rice or mashed potatoes, but that doesn't
It's not
have,
helping them.
that's not helping the protein.
How do you think you, outside of what you do when you're administering care, but you obviously have a focus on prevention, which I love to hear that. I think a lot of people, but it's a hard hill to climb. What do you think you can do to make a difference when it comes to prevention? How are you working within SAAK Health and with your partners when it comes to making a difference in prevention and
Well,
beyond?
people with diabetes should have regular exams, regular feet exams every time, because 85% of the people who have diabetic foot ulcer will end up in amputation. That's a very serious number.
Yeah.
Controlling their blood sugars, that is a way. So as a provider, I think we should focus on regular checkups and also controlling blood sugars, making sure if there is any signs of early infection, to go to your doctor right away.
Okay. How can people, how can you guys or us in general or communities make it easier to encourage people to make sure they get their checkups? So a lot of the times, you know how it is. People, you got to go in again. Or is there anything that you guys do here at SAAK Health to kind of make people feel more welcome, or like maybe like family or anything like that?
I mean, we are a very accessible clinic.
Okay.
So you don't have to go through the hoops in a corporate setup.
Oh.
Yes. And also if you have an issue, you can call us directly. We will answer your phone calls within a day.
Yeah.
And also we have everything, every diagnostic modality that can help you in SAAK.
You know, and you guys do have a wonderful facility here. I will say, trying to go to a hospital is to get this type of care. It's not fun at all. Whether it's getting from parking to the building or through miles and miles of corridors to get to where you need.
So it's a comprehensive and a compassionate care. That's our motto in SAAK Health.
Excellent. Anything else you want to share before we wrap things up today, Doctor?
Yeah, I also want to talk about our hyperbaric oxygen therapy, which we are going to bring in SAAK Healthcare. It's going to be available from November.
Okay.
This hyperbaric oxygen therapy is pressurized oxygen therapy to heal wound faster.
Okay.
So we will have two peri chambers, which are state of the art, and these chambers will help healing faster in patients who have diabetic foot ulcers, venous ulcers, post-radiation therapy, improving outcomes after surgery.
Okay. So tell us about the chamber itself. Is it like I'd be sitting in a tube and I'd be claustrophobic, or what's it like?
It's a comfortable tube. Let's put it there.
Comfortable tube.
It's with oxygen, high pressure oxygen going in.
Okay.
Targeted for the wound so that it heals faster.
Okay. So how long are these treatments to last?
It has to be, a typical treatment has to be for 40 days.
Okay.
It has to be 5 days a week.
Okay.
It lasts for 2 hours.
Okay.
And to improve outcomes.
Okay. So what do patients typically do for 2 hours while they're being treated? Is it an app? Do they watch a show? Do they listen to music?
We cannot have anything electrical inside the chambers, so there will be televisions outside.
Okay. So and they can see outside the chamber.
Mm-hmm.
Oh, so
definitely.
You can definitely be entertained.
Yeah, it's a glass chamber or an acrylic chamber, basically.
So you're not like in the dark.
No.
Oh, so it's just you're in a chamber, but you can see out of it.
And non-FDA indications for hyperbaric is nowadays people are using for dementia.
Really?
People are using for the athletes, sore muscles, for the regeneration, oxygenation to the tissue. They are improving post facelifting scars. Like these are the things that will heal faster.
Wow. There's a lot of applications for this type of medical. Very cool. So those will be ready in November.
Or first week of
November. Fantastic. Well, maybe maybe we'll come back and
You should.
and see those things
You should.
in action. Maybe I'll sit in one.
Why not?
Very cool. Well, doctor, thank you so much. This has been fantastic. I appreciate your time. I know it's very, very valuable, and hopefully we'll get a chance to sit down and talk again soon.
Thank you so much for having me.
You're welcome. Thank you.
Have a good day.
Bye-bye.